Coming up to the end of our live session in week 9, which means we literally have 4 more meetings together, 2 in ST 200 and 2 in ST 210. Okay. So tonight, what do we have? Your mini session is up. Make sure you stop on by Moodle, check it out. I do have some questions right off the bat, too, and then a couple more before we end, of course. And then we are getting into chapter 20. Now we're talking about diseases of the eyes, the ears, and the actual respiratory system. Quizlet, and then we're going to wrap everything up. But let's see, and this is for those who had the opportunity to watch. And if you haven't, that's okay. You can guess. All right. So the gastrointestinal GI system contains only resident bacteria as part of the normal microbiome, and transient microbiomes do not enter through food and drinks. What do you think this is? And it's just true or false. You can guess. That is correct. The GI system contains both resident bacteria, which are part of the normal microbiome, and transient microbes that enter through food and drink. So, yes, in case you see this question. One more question before we get started. Or actually, we have 2 more. Okay. Did I have it do it right? Okay, here we go. This one's a little bit different. Which of the following is the correct progression of H. pylori infection? You've got A, chronic gastritis, intestinal metaplasia, atrophic gastritis, and gastritic adrenocarcinoma. Did someone already say it? I see an answer already. Are you sure? Ah, okay. So I did see it. It's actually C. And I'm going to explain to you why, because I'm never going to just give you these and not tell you. Now, with H. pylori infection, it progresses through a specific sequence of different stages. And it starts with the chronic gastritis, which is that long-term inflation, moving to atrophic gastric, which is just the loss of like your stomach lining. So it starts to get weaker. And then it's followed by intestinal metaplias, where the stomach cells, they begin to resemble intestinal cells, which is not necessarily the best, and can eventually lead to gastric adrenocarcinoma, which again is stomach cancer. So that's why option C presents the correct order of progression. Okay. We have a couple more sprinkled at the end, but let's get into today, chapter 20. Okay. Our objectives, key terms, common infections, different pathogens, diseases, pretty much what we've been covering when we talk about each system each week. We're also going to look at preventative measures and then how it applies to us in the operating room. Right off the bat, in ophthalmology and eye and ear infections, we're talking about everything that's going to be in this area, okay? Especially common in children. We have our external ear. This typically hosts bacteria similar to those on like our skin, like Streptococcus pneumonia or even Pseudomonas aeruginosa. We look at our middle and inner ear. Okay, these are going to be those tympanomastoid or mastoid or just tympanoplasty cases where we're going into the inner ear. Okay. These areas are normally sterile. That's going to be really important. These are the cases where the microscope comes in. Okay. We do drape the microscope. We're going to talk about that in module 3. But these are going to be things protected by that eardrum. Unfortunately, bacteria can enter through the eustachian tubes from the actual throat. Once you do a couple ENT cases, especially if you do your first tonsillectomy, you're going to be surprised at how everything's connected. The very first time that I did a tonsillectomy and I gave the doctor a catheter, and they took the catheter through the nose, came out of the mouth, went back through the nose, and they clamped it. And I was like, oh, wait, it really is all connected. And that was because we get the adenoids out of the way. Okay. But don't let it freak you out. We do it all the time. But everything is connected. Okay. Your eyes, you have tears that naturally protect the eye from bacteria. But when infections occur, They often involve some type of negative staphylococci. All right. We look at conjunctivitis, or better known as pink eye. It is an inflammation of the conjunctiva, and that's going to be the membrane covering the eye and can be caused by bacteria or viruses. So, not just one. Common bacteria include Staphylococcus aureus, Staphylococcus pneumonia, Haemophilus, influenza. Um, we have STIs. In adults, some STIs can spread through the bloodstream and actually cause eye infection as a secondary issue. Not sure if you guys knew that. So for us, we just have to be familiar with common causes of conjunctivitis because it does help us understand potential eye infections and the need for appropriate infection control during surgery. Because again, we're going to address with everything because you don't want to take that home. Okay. With bacterial conjunctivitis, this is going to cause thick white discharge or pus, and it's treated with antibiotic eye drops or ointment. Contact users, so those of you that don't particularly care for your glasses, prolonged wear of contact lenses can lead to eye infections. We have what's called giant papillary conjunctivitis. This infection causes red bumps, and they're going to be on the inner eyelids. The patient's going to complain of itching, tearing, and heavy discharge. Contacts lenses are going to be stopped, right? Until the infection is gone. So we'll tell those patients that kind of hold off wearing contacts, just wear your glasses because you don't want to have something in there foreign when you're trying to heal your eye. Okay. Pseudomonas aeruginosa is common cause of serious eye infections like conjunctivitis, which can lead to severe damage if they don't come in and get treated promptly. Now, these infections often results from trauma or unfortunately post-operative complications. But with quick intervention, a corneal ulcer can destroy, or without, not with, without. I want you to think of it being your eye, the cornea actually being destroyed. Okay. And then the infection can spread to other parts of the eye tissue. With pink eye, everyone knows this is highly contagious and actually caused by airborne viruses, often along with some type of upper respiratory infection. What it does is it produces watery discharge, and antibiotics are ineffective. Anti-inflammatories or some type of vasoconstrictor medication may be actually used instead. Because remember, this is a virus, okay? But we also have non-infectious conjunctivitis. Can cause pink eye-like symptoms, but not necessarily pink eye. And this is from environmental irritants. Someone walking into an area that's full of smoke or chemicals. Now, allergic conjunctivitis is triggered by allergens. So for these cases, over the counter, like eye drops or allergy medications are going to be the ones that kind of just go in and alleviate those particular symptoms. The chapter talks about Stevens-Johnson syndrome. Now, this is rare. It's a severe allergic reaction affecting the skin and the mucous membranes. So you look at eye symptoms, it's going to include blepharitis, conjunctivitis, and the cause is uncertain, but it can be related to, let's say, drug infections, or it could even be genetics. But again, this is something that we're still trying to figure out. Okay. And of course, there's neonatal conjunctivitis. This can occur in newborns, especially if eye patches are used during phototherapy for jaundice. So they have to have that because they're going under the light. Okay. So whenever a baby is jaundice, we put them under the light to kind of help their system get better. And then they test them to see, okay, where are they at? Now, infections can spread to nearby structures such as their lacrimal glands or even their eyelids. And that's where you get eyelid infection or blepharitis. That's what blepharitis is. Okay. A serious form of conjunctivitis, neonatal gonorrheal ophthalmia, is caused by Neisseria gonorrhea. And this is when an infant passes through the birth canal of a mother with gonorrhea. Now, if untreated, it can lead to corneal ulcers, and unfortunately, they're more prone to blindness. Antibiotics are now used instead of the former silver nitrate treatment. And that's all going to be based on evidence based. Like they've gotten better prognoses using that. There's also chlamydia conjunctivitis, can be again transmitted during the birth canal. It can also occur in adults exposed to unchlorinated pool water, just so you know. And it is treated with antibiotic eye ointment. We have trichomel, and this is caused by chlamydia. This one leads to blindness due to like the scarring of the eye surface. It is the most common in regions of Asia, Africa, and among Native American populations in the southwestern part of the US. But trachoma is the leading cause of preventable blindness worldwide. Okay. So just remember, if you're getting in a pool, make sure that it is chlorinated. Okay. We get into ear infections. Pseudomonas aeruginosa is the main cause of otitis externa, also known as swimmer's ear. This bacteria thrives in the external auditory canal when it gets wet. So, making children who swim frequently just more prone to the infections during, let's say, summertime. Now, otitis externa causes like itching. They're going to complain of pain, but luckily it's usually short term. It's not going to be an infection that's going to be there for a long time. And it doesn't lead to like any crazy complications. We usually give the patient topical antibiotics and then some type of drying agent to kind of dry out the ears. And the biggest thing is to keep the ear canal dry and really prevent further infection. Now, we get into malignant external otitis, a severe form of ear infection. It's more common in older individuals and those with diabetes. Okay. So it'll go in and it'll invade the mastoid bone. And this is going to affect your auditory nerve, which is your cranial nerve 8. Okay. And then it becomes life threatening. Treatment requires aggressive antibiotics, and surgery may be needed to clean the infected area. So, this is when we go in and do those 10.0 mastoidectomies, where we're going in and we create a hole in the mastoid bone. We go through the tympano bone. We'll take a graft behind the ear, and it can be a little bit, you have a lot of different things going on. Okay. We have fungal ear infections. About 10% of external ear infections are fungal. Fungal otitis external is caused by Candida fungi. Now, you're going to have visible gray, black, or yellow spots in the ear canal. And the spores appear kind of cotton like under magnification. And you're probably wondering, well, how will they know? Well, we have ear scopes that we use in the operating room. And of course, the surgeon will check all that before they even come back to the operating room. So they're going to know what the plan of action is. Now, with Candida, it's typically causes a thick, creamy white pus discharge, but you're not going to see any visible spots. And so that's why you'll have to be like, is this Aspergillus or is this Candida? Well, not us. We'll just know because the doctor's going to let us know. But middle ear infections often are caused by bacteria, including Staphylococcus aureus, Streptococcus pneumonia. I feel like these same viruses and bacteria affect a lot of different things. Okay. We have otitis media, an infection of the middle ear, usually caused by viruses or Streptococcus pneumonia. It causes inflammation of the actual tympanic membrane. That's your eardrum. Okay. So the patients are going to complain of pain, fever, and there's going to have a lot of pus buildup. If antibiotics doesn't work or infections become frequent, a myringotomy procedure may be performed. 10-15 minute case tops. We get the patient in, we lay them down, we bring in the scope, a little stab of a knife, a myringotomy knife, tube goes in, drops go in, we're done. Okay. Um, and we'll put in PE tubes. So that's the other thing. And these are pressure equalizers, and that's going to help to relieve the pressure and drain the pus. 10-15 minute case. Not even going to joke you. It's really fast. Now, young children are more susceptible because their immune systems are still developing. You may see this somewhere. Young children are going to be susceptible because their immune systems are still developing. Keep in mind that the eustachian tube connecting the middle ear to the throat is smaller and more easily blocked by pus and bacteria. Remember, they're still little, right? The eustachian tube has a slight slope. So when you're loading your ET tube, you'll have your graspers, and you'll have it on the you'll clamp it kind of at an angle, and you'll see the doctor's hand as they're putting it in. They're not just going straight in. It'll drop a little bit and then kind of slide in. Okay. Now, that also makes it harder to drain fluid compared to us as adults. Children have like a 10% slope, whereas to we have a 35% slope. So they have more room to work with. So, unfortunately, because they're tiny and they're little, it creates an environment where bacteria can grow in the middle ear. All right. And ENT doctors, you could go in and have 6 or 7 cases, and then there'll be all myringotomies, and you're going through pretty fast. Remember, it's all connected. So we went from the eyes to the ears to the nose. So, sinusitis. This is an infection of the nasal sinuses, often caused again by Staphylococcus pneumonia or Streptococcus pyogenes. So, this one's a little bit different. Now, the infection causes inflammation of mucous membranes and it's lining your sinus, leading to heavy mucus discharge and blockage. Now, the pressure is going to start building up in the sinuses, and that's where the patients start complaining of pain, and they're going to also complain of headaches. They may even feel pressure behind their eyeballs. Okay. Antibiotics are typically used for treatment, but in more severe cases, they'll come in for a FES, where we will do a sinus surgery. We'll do an endoscopic sinus surgery. A lot of people don't really care for these cases, but you get comfortable when you're doing them. On the off shift, we're going to get whatever they tell us to do. So, the one thing I can tell you about these particular cases is when you go in and you're starting to open up the sinuses and you're starting to pull out all of the mucus and stuff, you'll first think it looks the same as we started, but it actually doesn't. What happens is we've opened up the sinus area and just allowed for the drainage to come. And so when you open up something, of course, more starts to come out. And what we're just doing is kind of like giving them a relief from all the stuff that was just stuck up in there. Now, this is important because if left untreated, the infection can spread to the brain. So that's why we get these patients in here and we do those sinus cases. So I don't want to go too far because I see um, a comment. My brother had to go in for an ear specialist for severe wax buildup and repetitive ear infections. And it was interesting to see the little camera look in. And we use those, maybe not necessarily the same cameras because we're under the microscope, but we'll use a camera and we'll go in and you get all the way to you can see a healthy here, ideally a healthy eardrum. So that was pretty cool that you got to see that. And my boyfriend had a sinus infection and the doctor put him on Z-Pak. That is one of the first antibiotics that we tend to give. I say we, like I'm still in the military and that's what we're doing, but y'all get it. That's one of the first things that they kind of subscribe because it when you use all the way to the end, right? We're supposed to use our antibiotics all the way to the end. It does help to kind of treat the sinus infection. And you want to take it all the way to the end because you don't want to get it to the point where the antibiotics or the medication stops working, right? You become resistant and then you have no other choice but to come to surgery. Okay, so that's actually pretty good. Real quick, how is he feeling, if you don't mind, on the Z-Pack? Has it helped? Has it relieved the pain, or is it like he's in the middle of taking it?
Yeah, he's actually much better. So this was, I think, last week or so. So he finished the whole bottle.
Perfect.
She also had him use something called Afrin, I think it was.
Uh-huh. We put that
But
up the nose. Yep.
yeah, and but she told us like make sure you follow those instructions very, very like clearly. Don't overuse it. But no,
Yes.
he's better now. Thank you for
Oh,
asking.
that's good. That is good because, like I said, after doing a couple of those sinus surgeries, and you once they get to the surgery part, they don't tell you this, but once you get to the surgery part, unfortunately, you tend to come back because we open it, but then again, we open it. You guys get what I'm saying? So now, even though it's like a necessary evil, right? Because we got to this point, but you're open, you're draining, but then you're open. And it's hard to kind of like, okay, it's better to get it out and have them come back than it to travel to the brain. So with that, we
I
get
have a
into our
question for
respiratory
you.
system. Go ahead. Go ahead, Kevin.
How's the blood pressure when they get this sinus infection? Is their blood pressure high?
Usually,
The
sometimes they'll come in, and it's going to really depend on a lot of different factors because we've had healthy patients where they had normal blood pressure, right? And but they could physically not breathe. And then you have other patients that for they have other comorbidities. So then they're going to have high blood pressure. And then on top of that, they can't breathe. And so that's another thing that we definitely watch. But then again, neuro is close because neuro deals with the brain. Neuro is on standby because let's say we go in, and this has happened where we go in where we're trying to get all the pus out. And when we get it out, I know this sounds super crazy because I'm not a pus person, but when I'm doing sinus surgeries, we want to see that because if we don't see it in the sinus, then neuro has to come in, right? Because then now they've got to go and do a craniotomy. And usually it's frontal craniotomy, but still. Well, great question. BP is usually it's going to depend on the patient with everything. Great question.
Thank you.
You're welcome. Now, we know that our respiratory system is highly susceptible to infection because we're breathing. There's pathogens everywhere. Our upper respiratory tract contains beneficial microflora, and that usually helps against harmful pathogens, while the lower respiratory tract is usually free of microbes because our upper respiratory tract, if it's working properly, is preventing anything from getting down. Common pathogens, you guys have heard them already: Streptococcus, pyogens, Microbacterium, Bordetella pertussis, whooping cough, and there's a lot more. So when we talk about viral, because I'm going to break these down, viral, I want you to think of like influenza, SARS, rhinovirus. Fungal, I want you to think of different microbiomes. So it's not going to necessarily be a actual virus. Think of, because I know you guys aren't going to know what pneumonia citis is. Think of like just fungus going around, okay? Like what a fungus looks like. All right. Now, the upper respiratory microbiome includes a lot of beneficial species, believe it or not. So we do have natural Staphylococcus, we do have natural Streptococcus, which does help prevent infection by competing with harmful ones. The problem is when it gets out of hand and then they come in and invade. Okay. That's the biggest problem. But bacteria can still get in there. Pharyngitis, throat inflammation. This is Streptococcus pyogenes, strep throat. We have laryngitis, inflammation of the voice box. Tonsillitis, another 15-20 minute case, believe it or not, where we have inflammation of our tonsils. And it can also be caused by Staphylococcus pyogenes. We talked about sinusitis, when your sinuses are inflamed. Epiglottitis, the little thing in the back of your throat, your epiglottis, it can also become infected. I have not done the surgery. We had to remove it, just so you guys know. But I have heard of different procedures, okay, where they try to do things to kind of fix certain things. We have to understand the importance because you may be in a sinus case. You may be doing tonsillectomy, adenoidectomy. They usually go hand in hand. You may be involved in a procedure dealing with the voice box, where you might have to be in a case where you're creating um, something to help with pharyngitis. Okay. So just kind of understanding what the case is will help you to be able to set up what you need. We get into strep throat. Okay. Acute bacterial infection of the pharynx, leading to symptoms like fever and pain. Yes, your tonsils are often involved, and you're going to see, like in this image, visible white patches. The bacteria can unfortunately spread to the middle ear, causing otitis media, which is just, again, an ear infection. If untreated, it can lead to serious complications like rheumatic fever. Transmission occurs through direct contact, aerosolized droplets, or even saliva. Okay. Talking about rheumatic fever, it is a complication that can arise from strep throat. Remember, I just mentioned how it can spread, but it only follows pharyngeal infections. It can lead to permanent heart valve damage, and that's why you have the picture of a heart valve on there. Sometimes requiring heart valve replacement surgery. So then cardio will be involved if it gets this, bad. Now, although less than 1% of strep throat infections lead to rheumatic fever, thank goodness, reoccurrence is common. So there is prolonged or lifelong antibiotic therapy that may be needed to prevent further episodes because, again, now they went from ENT to now they're on the heart service. Okay. So just different things to kind of think about. Again, our body is magnificent, but everything is tied in to each other. We look at acute glomerulonephritis. Okay. What are we talking about here? Our kidneys. Occurs where antigen antibiotic complexes go in and they invade the kidneys, potentially causing damage. So, believe it or not, some of the first things that we're going to do is test for none other than pharyngitis, which is a throat swab. Okay, we'll just go in there, they'll identify the bacteria that actually caused the strep throat. The sample may be put on a blood agar, they put it on the microscope and they may check it. They may do what's called a rapid antigen test that also detects bacterial antigens using different enzymes and acid techniques. Like they go and they do their thing, okay, just to determine what it is. Now, the thing is, the test may give false negatives. Nothing's foolproof yet. So, a standardized throat culture is also recommended if the rapid test is negative, just to confirm the presence of the infection. So, they'll go in, they'll take the swab still, and if it looks like the picture you saw before, and you're like, wait a minute, something's still here, they're going to still go further and do the standard culture just to make sure. Okay. Tuberculosis. There's a reason why we require TB testing before you come into the field. This is a chronic acute mycobacterial infection caused by Mycobacterium tuberculosis. It's a slow growing gram-positive bacillus. It primarily affects the lungs, but it can also spread to other organs through our blood system and our lymphatic system. So, how is this transmitted? Well, inhaling tubercle bacilli. Now, this is typically when an infected person coughs or sneezes. Once inhaled, some of the bacteria actually survive and they reach deeper bronchioles. So they're already going into your lungs. And then they're engulfed by alveolar macrophages. If the bacteria survive, so there's a chance, you inhaled it and maybe they start dying off and they don't infect you. But if the bacteria survive, they multiply and then they start creating small lesions or tubercles. These tubercles form a protective wall. They have their shields up around the bacteria. So instead of breaking it down, they're protecting it. And they release toxins that cause localized inflammation in your lungs. In some cases, the bacteria may become dormant, meaning they're not really doing anything inside, forming cheese like lesions. Okay. Over time, though, the lesions may start to classify and they start to get hard and become visible on chest x ray. So that's when you see the chest x ray and people are like, oh, you were exposed or you've had TB. And you're like, how can you see it? Well, they're looking at that classification. All right. If the tubercle liquefies instead of healing, it leads to growth of the bacteria outside of the macrophages and the formation of into a larger cavity. This allows the bacteria to become highly contagious. So then you got it from someone who was contagious, it does its thing in your body, and now you're contagious. Okay. The thing about TB is that it can spread to the circulatory and lymphatic systems, resulting in extrapulmonary TB, which can affect organs like your kidneys, your bones, and your brain. Okay. So for us, being in the operating room, it's really important for us to just understand how it works and how serious TB actually is. Okay, so we're not saying go get TB tested because we want to put you through torture. We actually want to protect you. All right, we have diphtheria. This is an acute respiratory disease caused by the bacterium Corynebacterium diphtheria, which produces toxins that can cause significant systematic infections, including heart damage and nerve damage. So the disease is typically spread through aerosol droplets or even direct contact or fomites. Fomites are objects or materials that carry infectious agents. The bacteria produces a grayish necrotic exudate known as pseudomembrane, and that forms over your larynx, your pharynx, and your tonsils. So you're talking about all of this, your voice box, your airway, and your tonsils. Okay. So that means that it's going to be a lot harder for you to breathe because it's obstructing the airway. And patients are doing everything to try to get some type of air into their body. You have cervical lymph nodes. They may enlarge. So you'll see patients breathing and it'll look like they have a bull neck because they're trying so hard, all their accessory muscles, just to try to get oxygen down, which is the hallmark sign of the disease. It can lead, unfortunately, to severe myocarditis, which is what inflammation of the heart, and conjunctivitis, inflammation of the eye. And these may develop as actual secondary complications. Now, this can lead to life threatening complications, especially if the airway becomes obstructed. They're going to be rushed because we've got to get them in to get an airway. Okay. We've got to. Um, and we also want to prevent systematic spread and any other complications. They may have to, those are those cases where you have the cut down tray right next to you and you're ready if you can't get in. All right. Whooping cough is a highly contagious disease caused by Bordetella pertussis, and it's spread through infected cough droplets. It progresses in 3 stages. I repeat, 3 stages. You have your catarrhal stage, starts with cold-like symptoms, a mild cough, nothing crazy. You have your paroxysmal stage, characterized by just violent coughing fits, gasping for breath, and then that whooping cough sound. And then you have your convalescent stage. Symptoms gradually resolve. But here's the kicker. Infants under 1 year of age are at high risk and they're often requiring to be hospitalized because of respiratory distress. Remember, their symptoms are, or their bodies are so small, right? Their immune systems aren't built up yet. And they can actually die from the disease. There are complications. Violent coughing in the paroxysmal stage can cause broken ribs. because you're constantly coughing. You're coughing to the point where you're shaking your body. Think about when you've ever been sick and you've coughed for a while and you feel sore in your ribs, right? Well, imagine if you can't stop. So it can actually cause broken ribs, it can cause hernias, it can cause rectal prolapses, or even severe breathing difficulties requiring the patient to be on a ventilator. Ear infections can also occur in children. So they're coughing and then they get an ear infection. But it does cause Bordetella pertussis, or pertussis, causes a milder form of whooping cough, and Bordetella um, causes a Bordetella bronchospectia, trying to make sure I'm saying them right, septicemia, causes kennel cough in animals. So whooping cough for us, kennel cough in animals. So how do we treat it? We do a nasal pharyngeal swab. It's used for culture. And then you're going to treat infants immediately. And before you test, results confirm the infection. So if we're thinking that that baby has whooping cough, they're going to be up in NICU being treated because it's better to treat them and then find out later, okay, then we can kind of step back on what we're doing. Infective individuals are contagious from the start of symptoms until weeks after coughing begins. The biggest thing is to prevent. Pregnant women should get the Tdap vaccine. So usually you get, like I got the Tdap when they gave it to me like I was 4 months pregnant during the pregnancy. So 27, 36, and maybe a little bit later, just to protect the mother and the baby. Pertussis is still a major cause of preventable deaths worldwide, not just whooping cough. Okay. And then the common cold. It's a viral infection, the upper respiratory tract, with rhinovirus being the leading cause. It accounts for half of all colds, while other viruses, including non COVID-19 coronavirus, make up the rest. Keyword non coronavirus. Now, rhinovirus has over 100 different types, making a vaccine difficult. So that's why when someone's like, I got the flu or the cold, or, and I'm sick, well, there's going to be different variations. The virus spreads through aerosol droplets from sneezing or direct contact with contaminated hands. That's why you're always washing. Sometimes I don't even shake people's hands because you just don't know. Okay. Now, when a person sneezes, fluid from the nasal pharynx filled with the virus is released into the air. The virus attaches to the surface of cells in the nasal pharynx, which is just the back of the throat and the back of the nose. And it uses surface molecules to kind of latch on to other cilia, the little hairs you have back there, on the host cells. Now, since the common cold is highly contagious, we have to be aware of potential spread, especially in the sterile environment. So, again, we're going to do like we normally do. We're going to be washing our hands just to prevent the transmission to patients and then other staff. Now, the flu. Let's talk about the flu. Another highly contagious viral infection that causes symptoms like fevers, chills, cough, headache, muscle pain. It can be dangerous, particularly for individuals who are immunocompromised, like the elderly or those with underlying diseases like pneumonia. The flu is the most common in the cold months when people spend more time indoors, which unfortunately helps the virus kind of thrive. It's like partying here. Now, one thing we're going to talk about, the Spanish flu of 1918 infected about 500 million people, a third of the world's population at the time. It also resulted in an estimated 50 million deaths worldwide, with 675,000 deaths being here in the United States. Why is this important to us? Well, we have to be aware of influenza because of the potential spread, especially because we have patients that are going to be sick. They're going to come in and out of our spaces, not necessarily in the operating room, because if they are too sick, we do cancel the case, just so you know. But we're going to make sure that we have on PPE. We're going to make sure we're practicing good hygiene. And this is all to make sure that we do not spread flu. And here's one that we all kind of remember, COVID-19, respiratory disease caused by the novel coronavirus, SARS-CoV-2. It was first identified in 2019. It has, unfortunately, since mutated into more transmittable variants like Delta and Omicron, which have continued to kind of spread the disease even when vaccines are available. So there are preventable measures, vaccinations, masks, you guys, hand washing. I can't even stress that. Like hand washing and cough hygiene. And of course, if you know someone is infected, you want to just, hey, stay away, step back, maintain some type of distance from them. We have those fungal respiratory infections. With fungi release airborne spores that can be inhaled, believe it or not, that lead to respiratory infections. Histoplasmosis, caused by the fungus Histoplasmosa capsulum, is one such infection that actually closely resembles TB, tuberculosis. Now, histoplasma spreads through the lymphatic and blood systems to other organs, creating lesions again, and this is what's visible on x-rays. The lesions often appear as you look here, snow, like just snowstorm patterns, which can sometimes be mistaken as lung carcinoma. So that's why you really want to go in and check, because you don't want to tell a person, oh, it's lung carcinoma, when it's actually fungal infection. Okay. Now, the fungus has a yeast-like structure and thrives inside our immune cells. So it's just good to kind of understand that it can affect the lungs and it can affect other organs. Bet you didn't know there's so many that affect the sinus, eyes, nose, and everything. We also have what's called valley fever. It is a pulmonary fungal disease and it is commonly known as valley fever. I would try to say it, but I would say it wrong. So valley fever it is. It primarily affects regions like American Southwest and Northern Mexico, where the soil is very conducive to just having a lot of fungal growth. The fungus reproduces through arthrospores, which are carried by the wind to a location. So if you ever see those videos or commercials where you see like the dandelion and one of the leaves flies and goes somewhere else, it's kind of how that works. All right. But once inhaled, the fungus forms thick walled lesions in the tissues. These lesions can cause aggressive skin and soft tissue infections, in addition to respiratory issues. So you've got all these skin issues, and it's hard for you to breathe. Okay. And this is figure from the book. Um, we have to be aware of valley fever because it can cause significant tissue damage, especially in the skin and soft tissues. So here, just being able to recognize what we've got going on again is going to help you better prepare and anticipate what you may need for your procedure if they bring a patient like this into the operating room. Blastomycosis is a fungal infection caused by blastomyces dermatitis. It is most commonly found in areas like Ohio and Mississippi River valleys and the Great Lakes region. Now, the infection itself is often asymptomatic, meaning that it does not show symptoms in most people, but in some cases, it can cause serious issues. The disease typically begins in the lungs, believe it or not. So by the time you see here, it's already been in the lungs, you guys. And it can spread to other areas like the bones, the joints, the central nervous system, and of course, the skin. When it affects the skin, it can cause cutaneous ulcers, leading to significant tissue destruction. Pneumonia, acute infection of the lungs and alveoli caused by various pathogens. It can be bacteria, it can be fungi, it can be protozoa, or even viruses. It's often secondary bacterial infection following a viral infection with symptoms like fever, cough, chest pain, and sometimes respiratory distress. Common causes, Streptococcus pneumonia, leading to pneumococcal pneumonia. This type of pneumonia affects the bronchi, the alveoli, and inflammation of the lungs' actual lining. And the patient's complaining of sharp chest pain. Pneumococcal pneumonia can also lead to more serious complications like pericarditis and respiratory failure. So the infection causes fluid buildup in the chest. If you were ever to listen to a person, it'll sound like there's just water in there, okay? Or like a solid organ. Okay, it's not going to sound, you're not going to be able to hear through it. And the thick capsule makes it resistant to immune disease, allowing the bacteria to not only be there, but multiply and spread. The actual spleen plays a big part in fighting the infection by kind of filtering the bacteria from the bloodstream, and it does help produce antibodies. A couple more diseases. Now, mycoplasmal pneumonia is caused by Mycoplasma pneumoniae, which lacks a cell wall. This pneumonia, often misidentified as a viral infection, it is common in young adults and children, and this is what's that walking pneumonia because symptoms are mild and patients can often function despite being infected. The chapter also talks about Klebsiella pneumonia. The bacterium causes severe pneumonia, especially in people with any type of comorbid conditions like diabetes, alcohol use, or chronic lung disease. It rarely affects healthy individuals, so that's something you should know. It is often associated, unfortunately, with healthcare associated and community acquired infections. It causes hemorrhagic necrotizing consolidation, also called lobar pneumonia. And this is where the actual the alveoli are destroyed, leading to the formation of lung abscesses. So then now you have abscesses in your actual lungs. A key symptom is carrot jelly sputum, which is they're coughing up thick, dark red, and that's because there is the presence of blood. For us, it can present with severe symptoms, but can still affect the lungs and compromise patients, especially during surgery. So we would be extremely vigilant in, okay, looking at everything that we have before our cases begin, okay? And then thinking about the particular cases that you're going to be doing with these types of diseases and bacteria. Now, again, we have our x-rays up, okay? We're trying to see, and these are going to be up in the rooms, depending on the surgical cases that you do. With Klebsiella pneumonia infection, this is one that's severe, all right? You have gelatinous capsules that make it harder for the immune system to kind of fight out because they're trying to fight against a hard surface, all right? If not treated aggressively, unfortunately, this can be fatal. So we get our chest x-rays. We are able to see the lung abscesses. There's going to be pus that could potentially be surrounded around the lung. And that is a condition called empyema. Empyema irritates lung tissue, and that's where they start to get scar tissue formation. When someone has alcohol use disorder, it's going to unfortunately significantly increase the risk of contracting this type of pneumonia, with 65% of affected individuals having this condition. The mortality rate can be as high as 50% and up to 100% if the infection is in the blood. All right. So, kind of things to think about. So, that means that patients with alcohol use become that much higher of a risk. I feel like we're talking a lot about pneumonia. We have Pseudomonas aeruginosa pneumonia, another bacterial infection that typically affects patients with pre-existing health issues like pulmonary disease, congestive heart failure, or cystic fibrosis. It is a hereditary condition that causes thick, sticky mucus to accumulate in the lungs. It increases the risk of piloorganisa infection. Now, once the bacteria colonizes the respiratory tract, meaning it goes in there and does its thing, like takes over, they trigger an inflammatory response, leading to a reduction in pulmonary function. So the lungs actually stop working at max production. Now, as the infection progresses, the bacteria form a biofilm. Remember, we talked about biofilm, which is a protective layer that makes it very, very difficult to treat and allows that bacteria to form more microcolonies in the bronchi. This is going to cause complications like inflammation in the actual windpipe and the bronchi. With patients with cystic fibrosis, the ongoing presence of the pylori organicia worsens the disease and contributes to those patients having a high mortality rate. Now, keep in mind that patients with cystic fibrosis, they're going to be highly susceptible for a lot of different things that could complicate the surgeries. And you would just have to have, certain extra things that you and the team have already talked about ready to go. Okay. The last part that we're going to kind of get into is legionellosis. It is an acute bacterial pneumonia caused by the Legionella species. This disease, commonly known as Legionnaire's disease, named after the outbreak at an American Legion convention in Philadelphia in 1976. Initially, the cause of the outbreak was just unknown. Like they didn't kind of figure it out, and they thought it to be a virus, but it was later identified as a gram-negative bacillus. Legionella bacteria thrive in warm water environments and have been found in places like shower heads, sink faucets, hot tubs, water heaters, decorative fountains, air cooling systems, and even building plumbing. Hospitals have been particularly affected, leading facility engineers to go in and regulate the water temperature a lot better, especially when it comes to the hot water lines, just to reduce the risk of bacterial contamination. Water systems used at colder temperatures should be just routinely tested to prevent the spread of that type of bacteria. So for us, we have to think that this can lead to pneumonia, making patients with compromised respiratory function at higher risk for complications during surgery. We have to be aware of the risks, especially in healthcare, because we're talking about maintaining safe water quality in the surgical areas and just having an awareness of, temperature control, routine testing. Of course, we're not in there doing the plumbing, but just kind of having an idea, okay, making sure if something doesn't look right, we speak on it. Okay. And this is going to just help prevent the spread of bacteria in hospitals environments. All right. So let's go back a little bit from the mini session. Lactobacillus is a beneficial bacterium that plays a key role in digestion, nutrient absorption, and protecting the body from harmful pathogens. Lactobacillus, think about what lactobacillus is. Think about where it's at. Is this a normal microbiome in the gastrointestinal and female genitourinary systems? I want you to think about our friendly microbiomes and our non-friendly microbiomes. Let's see what the actual answer is. And y'all know I'm gonna break it down. It's actually true. So when you guys go back to the mini session, make sure if there's something that doesn't needs more clarification, y'all let me know. But with lactobacillus, they are a part of our normal microbiome. Okay, it's already in our gastrointestinal and in the female genitourinary systems. It is considered friendly because it supports our digestion, it assists in nutrient absorption, and it helps protect the body by just outcompeting harmful pathogens. That's right. Someone wrote Greek yogurt. Therefore, the statement is true. And I grabbed this one because, hint, hint, concepts like this have been highly missed in previous, because I'm doing my work. And so I wanted to kind of get in front of it so that, we're thinking outside the box and we're like, okay, the first thing we have to ask when we talk about these different species, is it natural? Is it a normal microbiome, or is it one that's going to go in and cause harm to our body? If it's a normal one, then what does it do in our body? And so when we start to break it down that way, it starts to make like, okay, well, if it's natural, if it's normal, then that means that it has to do something positive for us. If it's not normal, then it's going to act against us. Does that kind of help break it down? Perfect. Just like the Greek yogurt. Okay. Y'all, I feel like we've been having so much fun. We have not been able to do one of our games. I'm okay with that. I'm okay. Sending you guys the Quizlet. It is based on this week. All right. Make sure you guys are utilizing it as an additional resource. With that, I will be sending out dun, 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 the final review on Monday. Not a requirement for you guys to kind of look at it, but I want you to have it. Okay. Now, keep in mind that that review is going to have week 10 stuff on it as well. I'm okay with that. I just want to give you guys an additional kind of week to kind of mentally prepare yourself so that you're going into that final exam ready to go. Okay. What questions do you have for me? No questions. All right. Well, with that, we covered terms related to the eyes, the ears, the respiratory system. We talked about a lot of infection, a lot of it with pneumonia. We identified different pathogens that are responsible for different infections of the eyes, the ears, and the respiratory system. We looked at diseases. We looked at preventative measures. A lot of it was washing our hands, right? And we kind of thought about how it's going to relate for us in the operating room. A lot of times we're doing everything that we're supposed to, PPE, washing our hands, and just performing with aseptic technique. Okay. That's what we do every day. For those of you that are watching the archive, we didn't forget. How do pathogens affect the eyes, the ears, and respiratory systems differently? What are the main challenges in preventing respiratory diseases? And how can we help prevent infections in the eyes, ears, and respiratory systems? We're wrapping up week 9, y'all. I want to remind y'all to stay focused. Y'all are killing it. Keep pushing as you guys gear up for this final exam. Your hard work, I'm noticing it, especially those of you that are able to get in your stuff early. Keep it up. For everybody, you guys are a team. I cannot stress. Once you guys get into the lab, you're going to lean on each other. I still have friends that I went to tech school with in 2000. We're still the best of friends because when you go through stuff together, you build a bond. Okay. With that, you guys have a wonderful rest of your evening. Have a wonderful rest of your week. Be safe this weekend, y'all. And I look forward to seeing everyone next week. Good night.